Hello there, welcome to the Tech Launchpad brought to you by Rwanda Asset Chamber. And as always, my name is Christian Zaramba, who gets to host this show every Thursday. We get to sit down and bring all the entrepreneurs and the young innovators, as we have been providing this space to them to be inspired and bring different guests here on the panel to hear their story, their foundation, and everything that they have done for you guys to get inspired. And as always, I'm going to be sitting down with the CEO of Haraka Meds, Karasira Aristide. Welcome to our show.
Thank you for having me.
Yes, we are glad to have you. We're going to be diving into everything and get to know more about Haraka Meds, but also because this space, as I said, we provide the space for other young innovators and entrepreneurs to get inspired from you guys who have been doing a lot and creating these platforms and tech platforms especially. So we are glad to have you. So starting off this show today, you can start by telling us what was the vision of creating Haraka, and tell us more about Haraka for those who don't know. How do you guys all work? What do you do? So tell us more. What is Haraka Meds?
Oh, thank you for the opportunity. Haraka Meds is a business more like a startup that started in 2021. So we are pretty much a digital platform where people can buy medication and other healthcare products. We do that by actually partnering with pharmacies around where people can buy their products without even going to the physical pharmacy. So we are solving an issue that is actually prevalent in the healthcare industry, where I don't know if it has happened to you, but we have so many testimonies that people go from pharmacy to pharmacy looking for medication. So it kind of takes a long time of their day, and sometimes they end up even not getting what they're looking for. So we are using technology to tap into that problem. So how did we start? So it started through experience. I don't know if I mentioned it, but I'm a pharmacist by training. So I'm together with my friends, and that's back in 2021. And we see that people are actually struggling to procure the medication. They don't know what is where in real time. So that's how we came about an idea to use technology to be able to be at service of the population and actually go beyond medication.
Yes, I feel like you're a pharmacist, as you just said. Yeah. You did it, it's something that you have been working in. As I said, you were solving the issue that was around. What do you think makes different, or what's the difference between other digital healthcare platforms and Haraka? What are your uniqueness and what makes you different? Because we have had so many other platforms, especially international platforms, and so many others. What makes Haraka Meds different?
So our value pretty much lies into the way our model is structured. So we are not a full stock pharmacy. We don't have the actual medication. We work by partnering with other pharmacies. That way we don't waste much time or resources procuring medication or stocking them. We actually invest more time and expertise in networking our clients to those products they are looking for. So I would say our specificity actually relies on that kind of framework, and also, like the name says, Haraka, we try to be really efficient in terms of delivery, professionalism. We actually make sure the clients talk to a pharmacist before they use their medication. More on services, I would say. That's how we are different.
I can call you guys, when I read your pitch, you're definitely a Rwandan Amazon, medical Amazon, if you can call it like that. So far, how has been the feedback? Before you go into the whole conversation, since you started having this platform, do Rwandans really engage with the rise of internet and use of phones and different platforms in Rwanda with the technology that we have been, the rise of technology we have been experiencing for the past years? How has been the feedback from people? Are Rwandans really engaging into Haraka Meds?
Yeah, that's a really interesting question. Maybe I can go back to the start when we brought the concept here. It was very new on the market, especially in the healthcare industry. So back in the beginning, we actually faced quite some challenges because there was no policy actually regulating such things as online pharmacy. But with the cooperation of the government, especially the agency in charge, the Rwanda FDA, we managed to get a license to operate, which was very new in the country. of course, it took time for people to start understanding what it is, but also helped us to bring up our credibility. So if someone sees that you are licensed by FDA, I mean, it's more credit to the business. So how are the people reacting? Actually, we have been having good feedback. We've been having an increased client base. Actually, what we are proud more of is that we have managed to retain customers that are coming back, that they have made it their only way to use when they want to purchase medical and healthcare products. So I would say it's coming up. People are knowing about this. I think with the right approach and the efforts that we're still bringing to this, this could be part of the culture here in Rwanda very soon.
Definitely. You claim to help people get access to their medication really fast and so easier, but also you enable pharmacists and to really be able to stock their data and also managing them easily using their online platform. Yeah. How are you managing both sides? Because helping people get their medications easy and a way that is so easier, but also helping the pharmacies. How are you guys like enabling both sides and helping and managing them?
Yeah, I mean, it's actually, we didn't have a choice but to go with such an approach of involving clients and businesses that we partner with. Like I said, when we wanted to bring this solution about, we didn't want to waste much energy putting up infrastructures that are already there. I don't know if you've noticed, but we have so many pharmacies in this country, especially in this city. Every block you see a pharmacy. Yeah, but what we want to bring here is, or what we are doing, is how do we connect that? How do we have some services that are interoperable, that actually could lead to good impacts, where, let's say, we decrease the expiries around in pharmacies. So we didn't have a choice but to work together with both approach. And I would say it helps the pharmacies to increase their sales. At the same time, it gives us visibility on what is where in real time, so that we can serve our clients in a very fast way and professional way.
How are you guys working with pharmacists? Because I feel like I need to know. Is there any fee that is on board for pharmacists to really join Haraka Meds? How are you connecting with them? How is every pharmacy, as you said in Kigali, you have had such an increase in pharmacies. Every block there is a pharmacy. How are you working with them? How are you partnering with them? How does that work?
Yeah, very good question. We have I would say requirements that a pharmacy should have before they start operating with us. It's basically a way to ensure that our partner is capable of fulfilling the services we want to work with, we want them to deliver. So after they fulfill that, we go into an agreement where we can procure from them and deliver to our clients. And we have an agreement on a certain percentage of how much we should be getting from such businesses. They also gain from getting that visibility we're providing them, an online visibility they didn't have before. So I'll give you an example here. Some pharmacies are really located in remote areas, and it's very hard for them to actually sell their products and avoid expiries and everything. So if such a pharmacy would partner with us, it means every single sale that will be happening around that area will be procuring from that pharmacy. Because there's also this proximity dimension about this, because we want to reduce the delivery time and everything. So pharmacies do benefit through visibility we give them, but also for us it's a partner that actually we can rely on to make our services even faster and more efficient. Yeah.
You seem to be dealing with sensitive information. When I want to talk about sensitive, like if somebody comes up to your platform and wants a medication, pretty much sure he's going to enter his data. How are you dealing with privacy, especially in these times when everybody is now using their phones and communication? There's always cyber threats and stuff like that, people stealing other people's information. How are you doing that and handling the privacy part of the platforms, like tech platforms especially?
Yeah, that's a serious threat actually to online businesses, not only in healthcare, but also it gets more sensitive when it comes to healthcare. So one way we are dealing with that, we managed to secure to be certified by the National Cyber Security Authority. Through that certification, we had to demonstrate that our data are secure and our clients can be assured they can work with us. Like I said, also we have a Rwanda FDA license. That also comes with a dimension where people dealing with such information are our trained professionals, normally pharmacists and nurses, that actually know the ethics of the profession, that actually can deal with those information with quite a number of ethics and everything. So that's pretty much how we are going about it, by working with the government to make sure that people feel free and more secure to work with us.
Yes, I read somewhere that your target is $50 million by the end of 2025. Yeah. How far are you on this, and what are you doing to release like the revenue goals that you guys are targets?
Exactly, we're on course, I would say. Yeah. And how we are doing that is through partnerships. So we're a company that's actually leveraged a lot on partnerships. Today we have secured a number of partnerships, but like I said, those physical pharmacies, but also government institutions in technology. We're in discussions with a number of them to be able to increase that client base so that most services are done through technology than the usual walk-ins in physical or healthcare facilities. So we're doing that to increase the serviceable amount of money and reach potentially that goal you just mentioned.
Yes, I would love to talk about the poor inventory management in terms of like the pharmacies who are stocking like medication. How are you dealing with that, and how are you supporting and being able, because I've seen the Haraka is really reducing a lot in terms of inventory management. How are you dealing with that?
Yeah, like I said before, we're trying to digitize this whole industry where we use technology to actually make services, operations communicate among themselves. So by that, pharmacies reduce expiries, or they are more visible, and also they get to be more predictable. With the data we have today, can actually advise a pharmacy on how to procure for the next 3 months, depending on the season or the kind of diseases that are frequent in that kind of season. So I would say using technology will contribute a big deal in making sure inventory is well managed. So we have in the pipeline an inventory management system that actually pharmacies should be using, that actually communicates with the online pharmacy platform that we provide them. So I believe those two combined, we will see a significant improvement in the pharmacy industry.
Yes, how is a platform user-friendly? Because with the software apps these days, sometimes it asks so many things to really get to the product that you want.
Exactly.
I'm pretty much sure people who are watching may be older, people who really don't know how to use a software application and stuff like that. How are you making these platforms easier for people once the medication may be fast and they are really sick and really seeking it to get that access so fast and easier? How are you making these platforms user-friendly?
Yeah, that's a good question. We actually have a web app, something that could be used on the web and actually easily used on the mobile. The way it's designed is it has WhatsApp features. We've noticed that Rwandans actually like to communicate more on WhatsApp. So we added a WhatsApp feature where you could interact with your pharmacist directly by either posting a prescription or messaging them, giving them what you're looking for. So that easiness we have given to our platform actually is to make sure everyone is included. We have, through our experience, we've noticed that there is a lot of people of old age that actually use our services, especially people with chronic diseases that do take their medication every month. So to keep that that monthly subscription going on and reminders we give them, we managed to actually make it as simple as down to a phone call. We actually get some orders on a phone call sometimes. So the aim here is to make it very easy. We have a mobile application in the pipeline. It should be actually ready to be used in the last quarter of this year. And with that also, we kind of waited until we have all the information so that when it comes out, it comes with a very user-friendly aspect for everyone to use.
Definitely.
Yeah.
We're talking about access for everybody. Haraka Meds, how do you ensure the affordability, of things? Because I'm pretty much sure we have all different socio-economic groups in Rwanda, rich people and people who are not in the middle. How are you showing that everybody can access the medication that you have on your platforms, and how are you making it affordable? That's the question.
Exactly, yeah. So in those partnerships we make with people in the business, in healthcare, especially pharmaceutical businesses, there's an aspect actually of, price reduction on some products. Let's say today we are actually involved with some of our partners in chronic disease, NCDs, non-communicable diseases, hypertension, diabetes. Medication in that aspect, we negotiate a cheaper price for them.
Yes.
And also the delivery fees are fairly adjusted for people to order and not, so it doesn't become a burden for them. And also I would say, like you said, the friendliness of our systems. Even a phone call is enough for you to make your order and talk to your pharmacist, not even for medication, just for advice sometimes. We do get people who call us for advice, something actually they would have to go to a real pharmacy, like a physical pharmacy to actually get normally. And also we are partnering with government institutions to be able to get access to that market. The government can actually provide down to the cells everywhere so that our technology can be used by the mass. Yeah.
Ending this conversation, I would love to know what are the future hopes and maybe features and in terms of geographical expansion and stuff like that. In few words, what are your future plans for this platform?
Yeah, so we have quite a number of objectives we want to attain, being a national-wide service so that we can cover every single corner of this country and go beyond, why not regionally. And also we want to improve our system and make it more a client-oriented system or platform where people would feel free to actually order online rather than going to a physical pharmacy. Yeah, so we see that happening via extensive feedback we receive and that we want to integrate in the system, and also by expanding our reach through the partnerships like I mentioned earlier. So expansion is the way, and improvement of our services.
Definitely.
Yeah.
Thank you very much, Kahasira Aristide. We are glad to have you here today talking about the medical medical in Rwanda, the pharmacy, and what you guys have been doing is really amazing. Hopefully, you can come back and talk about the expansion next year and more years, and talking about those $50 million US. I'm pretty much sure all of that will happen. So thank you very much for coming through. We are glad to have you. So that's it from the show of today. Thank you guys for tuning in. Hope you guys enjoyed the whole show. So see you next time.